Hi, my name is Alicia Marks, and this is a video for Nursing 225, Medical Surgical Nursing 2 through the University of Charleston. And I will be taking you step by step through 11 nursing skills today. The first is how to initiate a peripheral venous access IV infusion. When initiating a peripheral venous access IV infusion, you'll first need to complete the preparation steps. In order to make this video as informative and compressed as possible, the following steps will be known as the IV medication prep and will be referred to but not repeated later in the video. This includes, in order of completion, verification of the IV solution order on the MAR with the medical order, considering the appropriateness of the prescribed therapy in relation to the patient, clarifying any inconsistencies, and checking the patient's chart for allergies, checking for solutions for color, leaking, and the expiration date to make sure it is still good, gathering necessary supplies, perform hand hygiene, and putting on any appropriate PPE. Remembering that this procedure will be completed using sterile technique, identifying the patient, assembling all equipment at the bedside stand or on another surface within reach, explaining what you are going to do and why you are going to do it to the patient, and asking the patient about any allergies to medications, tape, or skin antiseptics as needed. If you're using a local anesthetic, explaining the rationale and procedure to the patient, applying the anesthetic to a few potential insertion sites, and allow sufficient time for the anesthetic to take effect. This completes the IV basic prep. These next few steps will be referred to as preparing the IV solution and administration set steps. This set of steps will not be repeated again either, but will be referred to later in skills. First, you'll be comparing the IV container label with the MAR, remove the IV bag from the outer wrapper, checking the expiration dates, comparing the patient identification band with the MAR, completing a time strip for the infusion and applying it to the IV container, maintaining aseptic technique when opening sterile packages and IV solution, removing administration set from the package and applying the label to the tubing, reflecting the date for the next set change. Next, you'll lose the roller clamp or slide the clamp on you'll loosen it or slide the clamp on the IV administration set, invert the IV solution container and remove the cap on the entry site, taking care not to touch the exposed entry site. Remove the cap from the spike on the administration set using a twisting and pushing motion. Insert the administration set spike into the entry site of the IV container. Alternatively, follow the manufacturer's direction for insertion. Next, hang the IV container on the IV pole, squeeze the drip chamber and fill to at least halfway. Open the IV tubing clamp and allow fluid to move through the tubing. Allow the fluid to flow until all air bubbles have disappeared and the entire length of the tubing is primed, meaning filled with IV solution. Then close the clamp if it's the type of tubing that requires the cap removed to allow the fluid to flow. Uncap it to allow the fluid to flow while maintaining sterility. Once the fluid is flowing, recap the tubing. This completes the IV administration set steps. Then you'll want to place the patient in low Fowler's position in the bed. Place a protective towel or pad under the patient's arm, provide emotional support if needed, and open up the short extension tubing package. Attach the needleless connector or end cap if not already in place. Clean the needleless connector or end cap with an alcohol wipe and insert a syringe with normal saline into the extension tubing. Fill the extension tubing with normal saline and place the extension tubing and syringe back on the package within easy reach. Select and palpate for an appropriate vein if the intended insertion site is visibly soiled. Clean the area with soap and water if the site is hairy and facility policy permits. Clip a 2-in area around the intended entry site. Next, put on gloves. Apply a tourniquet 3 to 4 inches above the venipuncture site to obstruct venous blood flow and distend the vein. Direct the ends of the tourniquet away from the entry site. Make sure the radial pulse is still present. Instruct the patient to hold the arm lower than the heart. Ask the patient to open and close their fists. Observe and palpate for a suitable vein. If the vein cannot be felt lightly, stroke the vein downward or remove the tourniquet and place warm, dry compresses over intended vein for 10 to 15 minutes. Cleanse the site with less than 5% chlorhexidine. Press the applicator against the skin and apply chlorhexidine using a gentle back and forth motion. Do not wipe or blot. Allow the area to dry completely for at least 30 seconds. Using the non-dominant hand placed about 1 or 2 inches below the skin entry site, hold the skin taut against the vein. Avoid touching the prepared site. Ask the patient to remain still while performing the venipuncture. Align the IV catheter on the top of the vein. Enter the skin gently, holding the catheter by the hub in your dominant hand, bevel side up at a 10 to 15 degree angle. Insert the catheter from directly over the vein or from the side of the vein. While following the course of the vein, advance the needle or catheter into the vein. A sensation of give can be felt when the needle enters the vein. Continue to hold the skin taut. When blood returns through the catheter, flashback occurs in the chamber of the catheter. Use the push-off tab to separate the catheter from the needle stylet and advance the catheter into the vein until the hub is at the venipuncture site. Release the tourniquet, activate the safety mechanism on the needle stylet. Compress the skin well above the catheter tip to stop the flow of blood. Quickly remove the protective cap from the extension tubing and attach it to the catheter hub and tighten the lower lock. Then stabilize the catheter or needle with your non-dominant hand. Continue to stabilize the catheter or needle and pull back on the syringe to assess for blood return. Then flush gently with the saline, observing the site for infiltration and leaking. Remove the syringe from the end cap. Next, open the skin protectant wipe. Apply the skin protectant to the site, making sure to apply it to the area to be covered with the dressing. Place a sterile, transparent dressing and/or catheter securing device over the venipuncture site. Loop the tubing near the entry site and anchor with non-allergenic tape close to the site. Then label the IV dressing with the date, time, site, and type and size of the catheter placed. Using an antimicrobial swab, vigorously scrub the needleless connector or end cap on the extension tubing and allow to dry. Remove the end cap from the administration set. Insert the end of the administration set into the needleless connector or end cap. Loop the administration set tubing near the entry site and anchor with non-allergenic tape close to the site. Then remove your gloves, open the clamp on the administration set the flow rate, and begin the fluid infusion. You can also start the flow of solution by releasing the clamp on the tubing and counting the drops. Then adjust until the correct drop rate is achieved. Assess the flow of the solution and function of the infusion device. Inspect the insertion site for signs of infiltration. Next, apply an IV securement device. If not already in place as part of the dressing, explain to the patient that the purpose of the device and the importance of safeguarding the site when using the extremity. These final steps will be known as IV and administration set insertion completion steps and will be referred to later in the video but not repeated. First, apply a passive disinfectant cap to each access site on the administration set. Using an antimicrobial swab, vigorously scrub each access site cap on the administration set tubing and allow to dry. Attach a passive disinfection cap to each site, remove equipment and return the patient to a position of comfort. Lower the bed if not in the lowest position. Remove additional PPE if it was used and perform hand hygiene. Return to check the flow rate and observe the IV site from infiltration or other complications 30 minutes after starting infusion and at least hourly thereafter. Ask the patient if they are experiencing any pain or discomfort related to the IV infusion. Next, I will be teaching you about changing an IV solution container and administration set. You'll again want to go IV in administration set preparation steps as previously described. Go through those. Then if you're using an electronic infusion device, pause the device or put it on hold. Close the slide clamp on the administration set closest to the drip chamber. If using gravity infusion, close the roller clamp on the administration set carefully. Remove the cap on the entry site of the new IV solution container and expose the entry site. Taking care not to touch the exposed entry site, lift the completed container off the IV pole and invert it. Quickly remove the spike from the old IV container, being careful not to contaminate it. Discard old IV container using a twisting and pushing motion. Insert the administration set spike into the entry site of the IV container. Hang the container on the IV pole. Another way to do this is to hang the new IV fluid container on an open hook on the IV pole. Next, carefully remove the cap on the entry site of the new IV solution container and expose the entry site. Taking care not to touch exposed entry site, lift completed container off the IV pole and invert it. Quickly remove the spike from the old IV container, being careful not to contaminate it. Discard old IV container. Using a twisting and pushing motion, insert the administration set spike into the entry point of the new IV container as it hangs on the IV pole. If using an electronic infusion device, open the slide clamp, check the drip chamber of the administration set, verify the flow rate programmed in the infusion device, and turn the device to run or infuse. If you're using gravity infusion, slowly open the roller clamp on the administration set and count the drops. Adjust until the correct drop rate is achieved. Next, you will repeat the preparing the IV solution and administration set steps described earlier in this video. You'll now want to hang the new IV container on an open hook on the IV pole. Close the clamp on the existing IV administration set. Also, you must close the clamp on the short extension tubing connected to the IV catheter and the patient's arm. If you're using an electronic infusion device, remove the current administration set from the device. Insert a new administration set into the infusion device. Put on gloves. Remove the current infusion tubing from the needleless connector or end cap on the short extension IV tubing. Using an antimicrobial swab, vigorously scrub the needleless connector or end cap on the extension tubing and allow to dry. Remove the cap from the new administration set, insert the end of the administration set into the needleless connector or end cap, loop the administration set tubing near the entry site, and anchor with non-allergenic tape close to the site. Open the clamp on the extension tubing, open the clamp on the administration set. If using an electronic infusion device, open the slide clamp, check the drip chamber of the administration set, verify the flow rate programmed in the infusion device, and turn the device to run or infuse. If using gravity infusion, slowly open the roller clamp on the administration set and count the drops. Adjust until the correct drop rate is achieved. Now you will complete the IV and administration set insertion completion steps from earlier in the video, and this skill is complete. The third skill I'm going to walk you through is monitoring an IV site and infusion. First, check your MAR. Do all of your IV checks noted in IV prep basics earlier in this video. You're going to want to make certain to monitor IV infusion every hour or per facility policy. More frequent checks may be necessary if medication is being infused. If an electronic infusion device is being used, please check settings, alarm, and indicator lights. Check set infusion rate. Note position of the fluid and IV container in relation to the time tape. Teach the patient about the alarm features on the electronic infusion device. If IV is infusing via gravity, check the drip chamber and the time drops. Time the drops. Check the tubing for anything that might interfere with the flow. Be sure clamps are in the open position. Observe the dressing for leakage of IV solution. Inspect the site for swelling, leakage at the site, coolness, or pallor, which may indicate infiltration. Ask if the patient is experiencing any pain or discomfort. If any of these symptoms are present, the IV will need to be removed and restarted at another site. Check facility policy for treating infiltration. Inspect the site for redness, swelling, and heat. Palpate for induration. And ask if the patient is experiencing pain. These findings may indicate phlebitis, making it necessary to discontinue and restart the IV at another site. Grade phlebitis. Check facility policy for treatment of phlebitis. Notify the primary healthcare provider for severe phlebitis, which would be either grade 3 or grade 4. Check for local manifestations of redness, pus, warmth, induration, and pain that may indicate an infection is also present at the site. And check for systemic manifestations such as chills, fever, tachycardia, hypotension that may accompany local infection at the site. If signs of infection are present, discontinue the IV and notify the primary care provider. Be careful not to disconnect the IV tubing when putting on the patient's hospital gown or assisting the patient with movement. Be alert for additional complications of IV therapy such as fluid overload or bleeding. Fluid overload can result in signs of cardiac and or respiratory failure. Monitor intake and output and vital signs. Assess for edema and auscultate lung sounds. Ask if the patient is experiencing any shortness of breath. Check for bleeding at the site. If appropriate, instruct the patient to call for assistance if any discomfort is noted at the site. Solution container is nearly empty, flow has changed in any way, or if the electronic pump alarm sounds, remove PPE if used, perform hand hygiene, and that is the full procedure for monitoring an IV site infusion. Next, I'll go through the steps of changing a peripheral venous access site dressing. The steps to changing a peripheral venous access site dressing are as follows. Determine the need for a dressing change. Check facility policy, gather your equipment, perform hand hygiene, and put on PPE if indicated. Identify the patient, assemble equipment to the bedside stand or overbed table or other surface within reach. Close the curtains around the bed and close the door to the room. If possible, explain what you are going to do and why you are going to do it to the patient. Ask the patient about allergies to tape and skin antiseptics. Put on gloves, place a towel or disposable pad under the arm with the venous access. If the solution is currently infusing, temporarily stop the infusion. Hold the catheter in place with your non-dominant hand. Beginning at the device hub, gently pull the dressing perpendicular to the skin toward the insertion site, carefully removing the old dressing and or stabilization securing device. Avoid inadvertently dislodging the catheter as it may be adhered to the dressing. Use adhesive remover as necessary. Discard the dressing and inspect the IV site for the presence of phlebitis, inflammation, infection, or infiltration. If noted, discontinue and relocate IV. Cleanse the site with an antiseptic solution such as chlorhexidine, or according to facility policy, press the applicator against the skin and apply chlorhexidine using a gentle back and forth motion. Do not wipe or blot. Allow to dry completely for at least 30 seconds. Open the skin protectant wipe, apply it to the site, making sure to cover at minimum the area to be covered with the dressing. Allow to dry. Place the sterile stabilization device over the venipuncture site. Next, I will explain the steps to capping for intermittent use and flushing a peripheral venous access device. You will need to determine the need for conversion to an intermittent access, verify medical order, check facility policy, gather equipment, perform hand hygiene, and put on PPE if indicated. Identify the patient, assemble equipment to the bedside stand or overbed table or other surface within reach. Close the curtains around the bed and close the door to the room. If possible, explain what you are going to do and why you are going to do it to the patient. Ask the patient about allergies to tape and skin and antiseptics. Assess the IV site. Refer to skill. If using an electronic infusion device, stop the device. Close the roller clamp on the administration set. If using gravity infusion, close the roller clamp on the administration set. Put on gloves. Close the clamp on the short extension tubing connected to the IV catheter in the patient's arm. Remove the administration set tubing from the needleless connector or end cap on the extension set using an antimicrobial swab. Vigorously scrub the needleless connector or end cap on the extension tubing and allow to dry. Insert the saline flush syringe into the needleless connector or end cap on the extension tubing. Pull back on the syringe to aspirate the catheter for positive blood return. If positive, instill the solution over 1 minute or flush the line according to facility policy. Remove the syringe and reclamp the extension tubing. If necessary, loop the extension tubing near the entry site and anchor it with tape, non-allergenic, and close the site. Using an antimicrobial swab, vigorously scrub the needleless connector or end cap on the extension tubing and allow to dry. Attach a passive disinfection cap, remove equipment, ensure the patient's comfort, remove gloves, lower the bed if not in the lowest position, remove additional PPE if used, perform hand hygiene. Our next step will be administering a blood transfusion. The steps to perform a blood transfusion, the next skill, are verify the medical order for transfusion of a blood product, verify the completion of informed consent documentation in the medical record, verify any medical order for pre-transfusion medication. If ordered, administer medication at least 30 minutes before initiating transfusion. Gather all equipment and perform hand hygiene and put on PPE if indicated. Identify the patient, assemble equipment to the bedside stand or over bed table or other surface within reach. Close the curtains around the bed and close the door to the room. If possible, explain what you are going to do and why you are going to do it to the patient. Ask the patient about previous experience with a transfusion and any reactions. Advise the patient to report any chills, itching, rash, or unusual symptoms. Prime blood administration set with the normal saline IV fluid. Put on gloves if the patient does not have a venous access device in place. Initiate peripheral venous access. Connect the administration set to the venous access device via the extension tubing. Infuse the normal saline per facility policy. Obtain blood product from the blood bank according to facility policy. Scan the barcodes on blood products if required. Next, we take a look at changing the dressing and flushing central venous access devices, verify the medical order and or facility policy and procedure, determine the need for dressing change. Often the procedure for CVAD flushing and dressing changes will be a standing protocol. Gather equipment, perform hand hygiene, and put on PPE. If indicated, identify the patient, assemble equipment to the bedside stand or over bed table within reach, close the curtains around the bed, and close the door to the room. If possible, explain what you are going to do and why you are going to do it to the patient. Ask the patient about allergies to tape and skin antiseptics. Place a waste receptacle or bag at a convenient location for use during the procedure. Adjust the bed to a comfortable working height, usually elbow height of the caregiver. Assist the patient to a comfortable position that provides easy access to the CVAD insertion site and dressing. The patient has a PIC, position the patient with the arm extended from the body below heart level. Use the bath blanket to cover any exposed area other than the site. Apply a mask and ask the patient to turn his or her head away from the access site. Alternatively, have the patient put on a mask depending on facility policy. Move the overbed table to a convenient location within easy reach. Set up a sterile field on the table. Open dressing supplies and add to sterile field if IV solution is infusing via CVAD. Interrupt and place on hold during dressing change. Apply slide clamp on each lumen of the CVAD. Assessing an implanted port is very important. Verify medical order and or facility policy and procedure. Often the procedure for assessing an implanted port and dressing changes will be a standing protocol. Gather equipment, perform hand hygiene, and put on PPE. If indicated, identify the patient, assemble equipment to the bedside stand or overbed table or other surface within reach. Close the curtains around the bed and close the door to the room if possible. Explain what you are going to do and why you are going to do it to the patient. Ask the patient about allergies to tape and skin antiseptics. If considering using a local anesthetic, inquire about allergies for these substances as well. If using a local anesthetic, explain the rationale and procedure to the patient. Apply the anesthetic as indicated to the port site. Allow sufficient time for the anesthetic to take effect. Place a waste receptacle or bag at a convenient location for use during the procedure. Adjust the bed to a comfortable working height, usually elbow height of the caregiver. Assist the patient to a comfortable position that provides easy access to the port site. Use the bath blanket to cover any exposed areas other than the site. Apply a mask. Ask the patient to turn his or her head away from the access site. Alternatively, have the patient put on a mask depending on facility policy. Move the overbed table to a convenient location within easy reach. Set up a sterile field on the table. Open dressing supplies and add to the sterile field. Put on clean gloves. Palpate the location of the port. Assess site. Note the status of any surgical incisions that may be present. Remove gloves and discard. Next, we will look at deassessing an implanted port. Verify medical order and or facility policy and procedure beforehand. Often the procedure for deassessing an implanted port will be a standing protocol. Gather equipment, perform hand hygiene, and put on PPE. If indicated, identify the patient. Assemble equipment to the bedside, stand or overbed table or other surface within reach. Close the curtains around the bed and close the door to the room if possible. Explain what you are going to do and why you are going to do it to the patient. Adjust the bed to a comfortable working height, usually elbow height of the caregiver. Assist the patient to a comfortable position that provides easy access to the port site. Use the bath blanket to cover any exposed area other than the site. Put on gloves using an antimicrobial swab. Vigorously scrub the needleless connector or end cap on the extension tubing and allow to dry. Insert the syringe with normal saline, unclamp the extension tubing, and check for a blood return as indicated in skills. If positive, instill the solution over 1 minute or by using a pulsatile flushing technique of 10 short boluses of 1 milliliter interrupted by brief pauses. Flush the line according to facility policy. Remove the syringe using an antimicrobial swab. Vigorously scrub the needleless connector or end cap on the extension tubing and allow to dry. Insert the locking solution syringe and instill the volume of solution designated by facility policy over 1 minute or according to facility policy. Remove the syringe and clamp the lumen. Remove the dressing and or stabilization device, noting any drainage, and discard. Finally, we look at removing a peripherally inserted central catheter, a PIC. Verify medical order for PIC removal and facility policy and procedure. Gather equipment, perform hand hygiene, put on PPE if indicated, identify the patient, close the curtains around the bed, and close the door to the room. If possible, explain what you are going to do and why you are going to do it to the patient. Adjust the bed to a comfortable working height, usually elbow height of the caregiver. Assist the patient to a supine or Trendelenburg position with the arm straight and the catheter insertion site at or below the heart level. Use the bath blanket to cover any exposed area other than the site. Put on gloves. Stabilize catheter hub with your non-dominant hand. Remove the dressing and or stabilization device, noting any drainage, and discard. Instruct the patient to hold their breath and perform a Valsalva maneuver as the last portion of the catheter is removed. If unable to do so, have the patient exhale. Using the dominant hand, remove the catheter slowly. Grasp the catheter close to the insertion site and slowly ease it out, keeping it parallel to the skin. Continue removing in small increments using a smooth and constant motion. After removal, apply pressure to the site with sterile gauze until hemostasis is achieved. apply petroleum-based ointment and a sterile occlusion dressing, measure the catheter, and compare it with the length listed in the chart when it was inserted. Inspect the catheter for patency, dispose of the PICC according to facility policy, remove gloves, ensure the patient's comfort, lower the bed if not in the lowest position, and that is how you complete our final skill. If you have any questions, please comment below and I will answer them for you. And I hope I was able to teach you something today. Thank you.